Okay, for administering an enema, identify the patient using at least two identifiers, usually the name and date of birth. Review the healthcare provider's orders for enema and clarify any reasons that it might be contraindicated or you need it. After identify the patient, assess last bowel movement, normal or unnormal bowel patterns, presence of hemorrhoids, pain, cramping, any distension, things like that. Assess patient's ability to move or turn to the position needed. You inspect the patient's abdomen, of course, with the gloves, and after you wash your hands for presence of distension. You auscultate for bowel sounds. Assess the patient allergy for any active ingredients in the fleet enemas. Determine the patient's understanding of the enema and the purpose of it. You explain to them why it's going to be done and why it's ordered. After you assessed everything and everything seems good to go, you perform hand hygiene and arrange your supplies at the bedside. Those should be some clean gloves, some water soluble lubricant, waterproof absorbent pads, toilet tissue, a bedside or a bedside commode, or have the patient he was able to walk, maybe go to a clear walkway to the toilet, a bath blanket, some basins, washcloths, towel, soap, and a stethoscope. If you're using the thing with the enema with the bag, you're going to need a IV pole, enema container with tubing and a clamp. Okay, so once you got everything ready, you assess the patient again, make sure he's comfortable with you proceeding with the procedure. You move the bed to the highest level with your hip to make it comfortable for you for working. Make sure the bed's locked and lock the bed rail on the opposite side of you so the patient can hold on to. Move them into left Sims position and make sure before you do all this to provide some privacy by closing the curtains or around the bed or closing the door. Make sure they have a comfortable private area where you do the procedure. You make sure the bedpan or the commode's close by if you have one. You perform hand hygiene before you do anything. You apply some clean gloves and place a waterproof pad on the other side of the patient while he's in left Sims position. You separate the buttocks to make sure he doesn't have any abnormalities like hemorrhoids, fissures, or erectile prolapse. You make sure they're covered up besides the buttocks area. You don't want them to feel uncomfortable. When you're administering the enema, you make sure you add warm water to the prescribed solution. Make sure the warm water is not hot, warm to touch. You could just pour a little bit on your inner wrist to make sure it isn't super hot or cold. You don't want it to be cold because it could make cramping happen. You raise the container of the enema. Make sure you open the clamp so you let the solution flow through tubing, and then you can close it back. Then you lubricate about 2.5 to 3 inches of the tip of the rectal tube with lubricant. You gently separate the buttocks and instruction the patient to relax by breathing out slowly through the mouth. Touch the patient's skin next to anus with the tip of the rectal tube, and then you insert the rectal tube slowly by pointing it in the direction of the patient's umbilicus until the length of 2.5 inches to 3 inches. You hold the tubing in place while it's in the rectum, and you release the clamp, allowing it to flow slowly with the container at the patient's hip level. Raise the enema bag to the appropriate level to make sure it's flowing at the right rate. It's usually like 12 to 18 inches. Once the whole thing is done, you may take it out, but put some layers of toilet paper around the tube at the anus and gently withdraw the tube. Explain to the patient that some distension and some cramping are normal. Ask them to retain the solution as long as possible so it could have the best effect it can. and stay at bedside. Have the patient quietly lay in bed if possible. Discard all your materials. Remove your gloves. Put the bed back into lowest position. If the patient needs help, make sure you help them to the commode or bathroom. Observe the characteristics of the stool and the solution. Help the patient if they need to get washed up or cleaned, and remove and discard anything else like what you would need with the gloves that you've been using to help the patient. Always make sure the bed's in lowest position and they're comfortable with a call light in hand.